This program contains actual surgical procedures. Viewer discretion is advised. The Long Island Plastic Surgical Group is the largest practice of its kind in the U.S., comprising 12 surgeons specializing in every facet of plastic surgery, as well as running the country's leading plastic surgery teaching residency. The group has been providing care to the people of the New York area and beyond since 1948, and now sees around 1,000 patients each week through trauma and burns work at nearby Nassau University Medical Center, the groundbreaking cleft lip and palate group, to more conventional cosmetic work. Over the years, the group's offices in Garden City, New York have been the scene of some amazing human stories. For the first time, our cameras have been allowed to follow the triumphs and transformations all taking place an hour from the heart of Manhattan. Joanie Nikolich's husband and 2 kids are her pride and joy. But Joanie's not proud of how her 2 pregnancies have affected her body. Her sister, Janine, is very honest about how Joanie's changed over the years.
She just let herself go and she doesn't take care of herself. And I think that the tummy tuck is going to change that.
Yeah, we do look.
If I just got the color.
Yeah, look.
She's younger, but she was taller than me, so we were like the same size. So it was always, you know, people would actually ask us, "Are you 2 twins?"
Joanie's getting a makeover from Janine, who's a hairstylist, but she feels like she needs more than just makeup to get back the old Joanie.
I was the leopard print and stuff like that. I was kind of a rock and roll girl, and I missed her.
She's particularly upset about the size of her stomach.
I've been looking at that in the mirror a lot, and I can't help but, you know, I like get all teary-eyed and stuff, and I say, oh my God, you know, that, here I go.
Don't cry now. Hello, freak.
I know, God.
I'm sure it has to hurt her when people look at us and say, she's your sister? Well, you don't even look anything alike. Or they give you a funny look. And, you know, she'll laugh it off, but I know she feels bad. It makes me feel bad. So I would like for her to feel better about herself.
I got to try and catch your tears because you're ruining my makeup.
I'm sorry. Sorry.
Don't cry.
Oh, I can't help it. I have not felt good about myself for a long time, and I feel so good now, and I can't even imagine how I'm going to feel when, you know, I go to the store and I go to try on those clothes that I land up crying in the dressing room because I can't fit into them, and now here I'm going to pull them up with no problem, and I'm going to button them and I'm going to zip them, and there's not going to be this pocket hanging out, and maybe I can show my belly button again. I was one of the first girls to ever show my belly button. You know, it's like a big curtain that hangs there, and I'm not used to that. I was used to always having a body that guys would look at.
Dr. Davenport is giving Joanie a tummy tuck and liposuction to get rid of that curtain on her lower abdomen.
So from here, this is going to be the bottom,
right,
and then we're going to come across the top like that. And all this is going to come out, and then this is going to get pulled down. This will be pulled up a little bit. So even though I'm drawing it way down here, you can see under tension, you see how it comes up to there?
Right.
That's where it's going to be.
So that's going to stretch my private area a little bit as well.
A little bit, but not much, because I'm doing it above that area. Okay, so it's not going to be this low. It's going to be about 2 inches
right there.
Higher. It's going to be right here. You see where this crease is? That's where it's going to be. But it's going to come all the way across. And all
like
of these stria, which you call stretch marks, are going to be taken out completely.
Really?
Yep. So all the stretch marks will be gone.
God, I've had them since I'm 20.
Yep, a couple of these little ones above your belly button will be way down here.
Oh.
But all the stretch marks will be gone. It'll just be smooth skin again.
And so then I won't have that little, see this flap of skin that I pierced, I won't have that
anymore?
You
won't have that anymore. If you want, I can make that again for you. It's up to you.
Excellent. I'm scared out of my mind. I'm very scared. I'm not very good with needles. Not at all.
I'm surprised I'm not shaking more. Usually I'd be like, I don't know, I'm scared. I have a lot of trust for the doctor. I don't know why, but I do. So I have to go with, I have very good instinct about people, so I need to go with that. They're gonna fillet me like a fish. Well, this is it. Next time you see me, I'll be a different girl.
You ready?
Dr. Davenport is doing more and more of these types of combined operations since he joined Long Island Plastic Surgical Group, as previous patients are referring their friends to him. The tummy tuck will actually mean that Joanie loses several pounds whilst on the operating table because of the flesh that's removed.
The tissue between her old belly button and down here has now been taken out. We're bringing the belly button, the new belly button, in right over here.
Now the tummy tuck's been performed, it's time for liposuction to create a defined shape for Joanie. Dr. Davenport is vacuuming out some of the fat above Joanie's hips to give her a more hourglass figure to go with her tighter, uplifted abdomen.
It's a very feminine look, so you want to leave her hip perfect. Thank you very much. Beautiful job, everybody. Okay, everything went perfect. Okay? You're going to love it. And again, everything is like I told you before. You have the drains in, and you're going to be sore down here. You'll probably be able to spend the night if you like. Okay? You awake?
It's 8 days after Joanie's operation to reduce her tummy. She's still very sore and bruised, finding it difficult to stand upright.
Okay. Again, it looks great. This is very, very swollen even now.
All right, talk to me about my belly button.
Okay, what's going to happen eventually, you have to wait, the belly button will actually contract down.
Will it go back to where it's supposed to be and isn't,
Yep, no,
is it too high?
Nope, that's actually the same place. The same belly button you had, I just brought out through the skin in a different spot.
Oh, okay. So it is my belly button.
It is your same
like
belly
that
button.
Because it's all swollen.
Because of the swelling, exactly.
Okay.
I can tell the results a lot more than you can, I think.
No, I can't see behind me.
Yeah.
But everything is where it's going to be, like
Yep.
it's not going to drop back down.
Nope. Remember this.
That was a good thing.
Yeah, this all used to come down over this, so that's
Right.
why it looks kind of strange right now because you're just not used to seeing that.
Right.
But again, now it's completely flat. We brought in, you can see here, I did liposuction on your waist, and I also brought your waist in, so this also kind of probably feels a little bit funny.
And it's all going to smooth out, though, like...
Remember, what
Right.
I did was I actually did the liposuction here, that's why this appears larger over here on the sides.
And it's, like, so bruised.
All the bruising will go away completely.
I always like to have a nice, tall, straight posture, and it's hard to walk around slunched over like me.
So now you're all set. Your drains are out. You just have to basically try and just start walking more.
And yeah, how do I
sitting
get
up.
to be able to stand up straight?
Yep, it'll just happen.
It'll just
slowly.
happen.
3 weeks later, and Joanie's standing tall and heading for the retail therapy that she's been eagerly anticipating with her sister.
I'm a girl that likes to show her figure if she has one, and I've covered up for so long. I don't want to cover up anymore, so bye-bye to this piece. Hello to this piece. Janine, let's get a couple more things that look the same, because remember, we used to get dressed like twins. Let's do it again.
Joanie and Janine have 1 or 2 outfits to try on.
Look, I have a belly. There it is. And look, these are a 12.
Hello. See? It pays to have a little hip. Thank you, Dr. Davenport.